into the room.
Good afternoon. My name is Dr. Oluwakade. I'm one of the doctors in this department. Could you please tell me your full name, your date of birth?
Absolutely. My name is Lucy Thompson. I'm 55 years.
Thank you. How do you wish I call you for this consultation?
Lucy is fine.
Thank you, Lucy. From my notes, I can see that you are here last week and you carry out some investigations. I'm here with your results. Is that correct? Okay.
Yeah, absolutely. I'd love to hear them.
All right, thank you. But before we go ahead about this result, I need to ask you some questions in order to be in the best position to help you. Are you comfortable with that? Oh,
absolutely.
Thank you. Thank you, Lucy. What was the exact reason why you did this test?
Oh, well, you see, doctor, I've been having this tiredness and I've been getting so tired, especially in the last few months, like 2 months, I would say. And yeah, I thought I should just make sure that all my blood tests are fine. So that's why I got these tests.
Oh, this must be quite challenging for you. This tiredness started gradually over the last 2 months. Did anything make it worse?
Not really. It's actually, like you said, it's kind of gradual for the past 2 months. And yeah, it's been getting worse over time, I would say.
Okay. How is this affecting your daily activities?
Yeah, I mean, what to say? I'm not able to, do my daily work like I usually do. I'm getting very tired very fast.
So sorry to hear this. Do you notice that you have difficulty in breathing? You have heart racing?
No, not that I have noticed actually. No difficulty breathing.
Any episode of dizziness?
No, not really. I just get very tired fast.
Any weight loss or night sweat?
No, not really. No weight loss, night sweats.
Okay, thank you. I need to ask you some questions about your background state of health. Is that okay with you?
Yeah,
okay,
sure.
Okay, thank you. Do you know whether you have any long-term problem with your bowel, like abdominal problem, tummy problems?
Well, since you've asked, I've not really been having great bowel motions, Sometimes I have these bloating and abdominal pain. And it's been there forever. It's been like some 10, 20 years since I've been having that, but it's okay. I'm going to live with it.
Oh, sorry, dear. Is anyone in your family having problem with tummy problem?
Well, I have a cousin sister who has something called celiac disease. She's basically on all these gluten-free diet and all that.
Okay, I see. Are you currently, do you have allergy to any food or any medication?
Not that I know of, no.
Okay. Are you currently on any long-term medications?
No, not really. Kind of fit most of the times.
Okay, thank you. Concerning I will quickly need to, I need to ask you some lifestyle modification. Do you smoke or drink alcohol?
No, not really, but I drink occasionally, whenever there are these functions.
What about your diet?
What about it? I mean, I eat everything. I'm not very picky.
Okay, I see. Now, I would like to do some examination for you, which include general physical examination, blood pressure, oxygen saturation, and respiratory rate. Is that comfortable with you?
Sure, that sounds good.
I will also look at your tummy. Thank you, Lucy. Based on what we've said and based on the finding from the examination, I will discuss your test results. Are you comfortable to hear it now?
Sure, yeah, please.
Or do you want anybody to be with you?
No, not really.
All right.
I'm fine. I can hear it.
Lucy, the result shows that transglutaminase antibody is positive. Do you know what that means?
No, not really. What is
Actually,
transit?
it's a type of protein that is secreted in the body, and it is high when you have a condition called celiac disease.
Oh God, the thing that my
Yeah.
sister has?
Something like that. Do you have
Oh
any
my,
idea on what might be causing this?
I'm not sure. I mean, my sister has that. Is this something that runs in my family?
Exactly. So there are genetic uh, some people are more genetically susceptible to have this condition. Do you understand?
Oh my, I have never thought of it. Is
Yes.
my
So
bloating related to
yes,
that?
what it means is that the body is overreacting to the presence of certain uh, materials in food, like gluten.
Oh, okay.
As a result of that, it may
Mm-hmm.
also affect the way you absorb food, and which
2
can
minutes
cause you to
remaining.
have anemia. Do you understand that?
Oh, what is this anemia that you're
It's low
calling?
blood level. That is why the result of the second test, hemoglobin level is 9.8. So if you, because of this celiac disease, you may not be able to absorb all the necessary nutrients that you need to make blood. Do you understand that?
Oh, I see. Wow, I didn't think that would. Will I get better? Is my tiredness because of that?
Yes, what we need to do now, we need to confirm it by sending you to do a procedure called endoscopy. Have you heard of this before?
Is it the one that the camera goes into your mouth?
Yes, the
Oh,
flexible tube will go into your mouth, and if there is any suspicion lesion in your gut, a small sample will be taken out and sent to the laboratory for confirmation.
oh no, doctor. I mean, that sounds terrible. I don't want to do that. Isn't there any blood test that you can do? Isn't the blood test enough? Can't you just start me on
We
treatment?
can do blood tests, but they are not going to confirm this. The blood test can, like full blood count, like erythrocyte sedimentation rate, and markers of inflammation, they can only help as adjuncts, but they cannot confirm this. So what we are going to do, we are going to make sure that you are comfortable during this procedure. Do you understand me?
Yeah, but how are you going to do that? How are you going to make sure that I'll be comfortable during this? It sounds
Okay,
terrible, this procedure.
we may put you to sleep during the procedure. Then I'm going to give you a leaflet where you will read more about it. I will direct you to NHS website where you read more about it. Then I will give you a follow-up appointment in 2 weeks' time. Is that okay with you?
Move on to the next station.
Good job, doctor.
Thank you.
I think that went really well. You did cover a lot of good points. Good job. But one thing that I want to say is do not ever prevent the patient from talking. You know, as soon as you said something like this is celiac disease, I asked you a question, is my tiredness because of that? You didn't answer that. You said something else on top of it. So you will lose marks for listening, right? So anytime the patient talks, just stop and listen to them. Like, I'm sorry, you said something. Can I answer any of your questions? Right. So if you, one thing is that you always have to be very attentive when they talk. Your consultation at this time, I think by this third attempt is pretty good. You managed to get to management. You did a lot of good data gathering. Good job on that. And but never, even though your time is running out, never over talk on the patient because your interpersonal skills will take a hit, as well as you will get ticked for listening. Right. So, like I said, you are always there to answer the patient's doubts. So, as soon as they have a doubt or they say anything, just be attentive because they are going, that's kind of like a clue they're giving you. Right. So, every time they say something, it's like you have to be attentive to that and you have to pick it up and you'll understand that that's kind of a clue that they are trying to give you. Right. But I think this one was very good. And
Oh, thank you. Thank you.
I would say. So we will have the examiner checklist. Is it ready? Right. So let's see how you did for this one. Not bad. You got 2 plus 3. So that is around 7. Not bad, doctor. That's a pretty good score. Let's look into all the things. Inquire about family. Actually, you did this one, so I'm going to give you a yes for this. Understand patient's understanding. Actually, you did this one, so I'm going to give you a. See, there you go. You got data gathering. I think you've got all 4. Good job. And
Thank you.
emphasize on maintaining gluten-free diet. Right. So you started by confirming the name. That was great. You confirmed, you actually used the data that you had from the question information. You used that and you asked them, yeah, you've come for a blood test. I understand. Can you explain a little bit about why you had the blood test? So I told you, like, openly, I told you, like, yeah, this is what I've been having. So since you had TTG positive, you already knew it was celiac. So you started ruling out all the other differentials. And then you asked about the bowel. Like, do you have any long-term conditions? See, that's the thing, right? The patients, even though they have tiredness, they don't know it's because of the celiac, right? Like, they had no idea that this could be a bowel condition. So this is what your task is. Like, even though they have an issue, you have to, and they have another symptom, you need to bridge that gap for them. You know, they, as a lay person, they don't understand that the celiac, which is a bowel condition, could be the cause for their tiredness. So in their mind, there is no relation between tiredness and the bowel issue. So your job is to make that connection, saying that this is a celiac disease where, you know, nutrients are not getting absorbed, and because of which your blood cannot be made, and because of which you have a condition called anemia, because of which you have tiredness. See, so that way I'm like, oh, I see. Now I understand. And you did that very well. Good job on that. Like, you explained
Thank you.
everything. But now another thing is that you have done the task of explaining the patient. Now, what does celiac disease actually cause? It can cause a lot more problems than the nutrients, right? So you have to also, this is actually partial, so where you have to explain about the DEXA scan. So you need to say that you have to confirm it by doing endoscopy to understand, since it's a problem in your bowel, we need to actually see the bowel to understand how the extent of the condition is, and we need to go in and take a sample to confirm it. Blood test is not always, you know, confirmatory for such conditions. So I'm sorry, we have to put you through this, so we have to do this condition. And we will also have to take some scans of your bones called the DEXA scan to see if it has affected any other part of your, you know, systems, like your bones, like you've been depleted of the, you know, the nutrients that could affect your bones as well, right? And as a long-term plan, basically, you have to say that you have to continuously keep coming for these. Like, you have to, since you have this condition, we have to put you on gluten-free diet, right? And we have to continuously be doing these endoscopy and DEXA scan to see how much nutrients you're actually getting. So that's a long-term plan, right? Otherwise, mention the blood test and determine the type of anemia. That was also done very well. And testing for any first degree relatives. So this is since it runs the family, you know, if she has, you need to understand if she has any children or any other first degree relative, like brothers or sisters who could suffer from the same condition. So you can always tell them that they can also get tested for these things, right? Right, since it's a genetic, right, that's something. And now look at the setting. So let's see our setting. This was in, wait, I can just pull this up from here. Yeah. So this is in the gastroenterology department, right? So you can always, since you're a junior doctor and you have to, you know, since she's so concerned, you can always call in your seniors for additional help. Right. So you can always say that I can get a second opinion if you like from my senior, and ask him, you know, if you need to be possibly referred to somebody else, like maybe ortho, for checking the bone conditions because of the celiac complications, right? And you gave the educational material, and yeah, you got the consent because that's your task. Good job. Yeah, I guess this was. Yeah, so dietary care also, you could have given some leaflets and pamphlets, because that is like, that's what you have to be informed. The patient education should be also about. But good job. This look at that. That's a great performance. So yeah, let's move on to the next one. How are you so far?
Please like and subscribe to TuringMedSchool. Good luck with your preparation.